Okay, kia ora. Welcome back, everyone. We're on to session 3. So this session's topic is new thinking on old techniques. And our chair for this session is Sarah Babington. So she's coming from RSPCA Australia, and she'll be chairing the session, introducing our speakers, and we'll have a great discussion at the end. I just want to remind you that for questions, we've got our question box, which you can add to throughout the sessions. And we'll be looking at those and pulling those up at the end of the session. So I'm just going to introduce you to Sarah. Sarah, can you pop on and say hello? There you are.
Okay, awesome. Thank you, Kat. Thank you so much for having me, and I'm really glad to join you all today and to chair this session on new thinkings on old techniques. We've got 3 fantastic speakers up for you. So first up, which is going to give me a run for my money around pronunciation, but I'll give it my best shot. We've got fasting period and analgesia in streptozotocin-induced experimental diabetes in rats, which is going to be presented by Marisa Esteves-Monteiro at the School of Medicine at Biomedical Sciences, University of Porto.
So good morning to all the viewers. I'm going to talk about fasting period and analgesia in streptozotocin-induced experimental diabetes in rats. So let's start with the introduction. Diabetes is a widely known chronic progressive metabolic disorder that can affect almost every organ system in the organism. It is highly prevalent around the whole world, as we can see here in this map, and is associated with high mortality and morbidity rates, besides representing a substantial economic impact. Knowing the importance of diabetes, it is easy to understand that there are several animal models to study this disease. We have here some examples of those models. Streptozotocin, that I will now call STZ, is a chemical compound that has the ability to enter beta pancreatic cells, that are cells responsible to produce insulin. STZ enters these cells using glucose transporters, causing their destruction, so the pancreas loses the ability to produce insulin. STZ can be used to cause both type 1 and type 2 diabetes, depending on the technique. This model has been the agent of choice to induce diabetes for 3 decades now, and is very used, mainly in rodents, mice and rats. Due to the STZ mechanism of action, fasting period is usually recommended before the induction to avoid competition with postprandial glucose, but there is no consensus on how long this period of fasting should be. I have here some examples, and this period goes from 24 hours fasting to 16 or overnight fasting. By far, overnight fasting is the most common one that we see. And this overnight fasting can be from 16 hours to 8 hours. And why? Why is so common overnight fasting? Because it represents an adequate period of fasting for a lot of protocols, not only for inducing diabetes, and at the same time is easy to fit the schedule of the professionals that are involved in procedure. So they remove food before going home in the day before, and then in the next morning they can start the procedure when they come to work. However, we have to keep in mind the welfare of these animals. And overnight is actually the most active time for rodents, representing 80% of the food intake in rats and 2/3 of the food intake in mice. So it has a lot of impact in their welfare. There are a lot of papers approaching the impact of fasting, the negative impact of fasting, even when it's a single episode. And if I'm going to talk about negative impact of fasting, I would be here all 15 minutes. So I'm just going to talk about these 3 points. The only one single episode of fasting is associated with weight loss and increase in locomotor activity in rats, because they start looking for food. And this is really important when we are going to induce especially type 1 diabetes, because we are expecting some weight loss associated with the disease, so we want to minimize the weight loss that occurs before the induction. Overnight fasting is also associated with increased aggression and more excitability in rats. This is also very important to us because these animals tend to become more resistant to manipulation, and this could interfere with the induction. After STZ induction, there is a period of hypoglycemia before we get the expected hyperglycemia, and hypoglycemia after induction is more pronounced in fasted mice and is associated with higher mortality rates. We also talk about analgesia. We consider that analgesia because lesions of pancreas like inflammation or pancreatic cancer are usually very painful both in animals and in humans. In this case, we don't have inflammation or cancer, we have some destruction of pancreatic cells, so we cannot say for sure that it's a painful event. But we also cannot say for sure that it's not. So we have to consider at least the possibility of being a painful event. So we decided to use analgesia. We decided with tramadol. It's a central analgesic, commonly used for moderate and severe acute and chronic pain. We have to keep in mind that tramadol has no immediate analgesic effect after oral administration, but this effect can be obtained 30 minutes after administration and can last up to 10 hours. Tramadol is also associated with a hypoglycemic effect, so we have to be extra careful during the hypoglycemic period after induction. So having in mind that STZ is equally diabetogenic in fasted or fed mice, that the deprivation period in rodents should be done during daytime, and that the analgesic effect of tramadol can last up to 10 hours, while the most of the destruction of the beta cells occurs during 8 hours after STZ administration. Our aim with this study is to refine the STZ-induced model of type 1 diabetes in rats by decreasing the fasting period to 4 hours, then in the morning of the induction, and also by providing analgesia. So let's go to materials and methods. So you used 30 male WISA rats, 22 were used to induce diabetes, and 8 were used as controls. On the day of induction, we fasted the animals for 4 hours in the morning, and then we performed induction with the intraperitoneal injection of STZ with a dose of 55 mg per kilogram under the analgesic effect of tramadol administered orally moments before. At 28 hours, we did confirmation of type 1 diabetes. All the animals that presented glycemic values superior to 250 were considered as diabetic. After 14 days, we redone the glycemia evaluation, and then the animals were allocated to their respective experimental protocol. Every day, we did a monitorization. We evaluated any signs of pain. We used the Grimace scale. We evaluated the welfare of the animals, and also we did a monitorization of the body weight and the food and water intake. So let's go to results. In the first induction, we used 10 rats and 8 became diabetic. In the second induction, we used 12 and 11 became diabetic. So from a total of 22, we had 19 diabetic animals. This represents an average rate of induction close to 86%. We had no signs of hypoglycemia after induction. This hypoglycemia usually occurs 2 to 8 hours after induction, and we had no mortality. Our rate of induction is very close to what's expected in this kind of protocol. According to Foreman, we should get superior to 80%, and with concentrations between 40 and 70 of STZ. That was our case. We used 55. And in this study that used a similar concentration, they got a rate of induction of 76, which is actually lower than ours. So regarding glycemia, we see here at day 0 that both groups have similar values, but when you go to day 2, diabetic animals had values close to 400, and at day 14, most of the animals had values superior to 500. These values are pretty similar to what other authors found. We have here in this graphic, and you see diabetic animals with values close to 500, and in this study it's roughly the same. So the potential confusing effect of tramadol administration on day 0 didn't affect the expected hyperglycemia. Also, we can say for sure that these animals maintained as diabetic throughout the whole protocol. We measured the body weight. As expected, diabetic animals presented with some loss of body weight over the 14 days. However, I think it's interesting to see that between day 0 and day 1, they did not present a loss of body weight. Our values are pretty close to what other authors have found. This author stated that the body weight decreased remarkably 2 days after induction, and that is actually what happened in our study. But this is what is expected with this kind of protocol. Regarding the food intake, we can see that diabetic animals increase their food intake over time, while control animals maintain a relatively stable food intake. Our results are in accordance to what other authors found, and once again, it's what's expected in this protocol. The same happened with water intake, but the difference is even more pronounced. We see here the curve of the diabetic animals. They increased a lot their daily water intake over time, while control animals maintain a stable water intake. Once again, it's pretty close and similar to what other authors found. And once again, it's what expected with this protocol. So let's go to conclusions. With this study, we believe that it's possible to refine the STZ-induced type 1 diabetes model that, as I stated before, it's very, very common. We only decrease the fasting period to 4 hours and add analgesia, but decreasing the fasting period to 4 hours, we're able to remove the food in the morning of the procedure, so we are respecting the animal's natural circadian feeding rhythm. With this, we are minimizing a lot the negative impact of fasting and contributing to the welfare of the animals that we are using in our experience. When we talk about the professional schedule, the reality is that the 4-hour fasting is very easy to adapt, because you can come in the morning and you start fasting, and if you have an 8 hours working day, you still have another 4 hours after fasting to do the procedure. With these two alterations that we have done, we were able to attain the expected rate of induction and also the classical diabetes signs, polyphagia, polydipsia, and weight loss. And it's very, very simple refinements. We don't have to spend any more time in training, or we don't have to spend more money in equipment, and all of this without jeopardizing the experimental objective. Our study has some limitations, however. We didn't have a control group with other fasting periods. and we only used 22 animals and only males. Also, we didn't measure glycemia and weight after fasting. We did our measurements before fasting because we didn't want to have any more stress right before the induction. But without these measurements, we cannot state for sure what was the impact of the 4-hour fasting. So thank you all for your attention. I would like to thank my co-authors for their contributions to this work, and also I would like to thank the organization of the workshop for giving me the opportunity to present my work. Thank you.
Thank you so much for that talk. That was really interesting. So we'll move on to our next talk for today's session, which is considering the ethical welfare and commercial interests of artificial insemination techniques in greyhound breeding females. And this will be done by Michelle Ledger at Greyhound Racing New Zealand.
Hi, today I'm going to be talking to you about the research project that I completed for my master's dissertation titled Considering the Ethical, Welfare and Commercial Interests of Artificial Insemination Techniques in Greyhound Breeding Females. I'd like to declare that at the time of performing this research, I was the Chief Veterinary Officer for the Greyhound Welfare Integrity Commission in New South Wales, Australia, and I declare this as a perceived conflict of interest. So by way of introduction, the two most commonly used intrauterine insemination techniques are surgical insemination, which, as the name describes, requires an abdominal surgery not dissimilar to a standard spay technique in order to inject semen directly into the uterus. And the second technique, which can be performed standing and usually awake, requires the use of a video endoscope, which is inserted vaginally and allows a catheter to be extended through the cervix for semen to be deposited directly into the uterus. Now, most of the inseminations in Australasia are performed surgically, with breeding predominantly done with the use of frozen semen. And when we looked at the literature studies, we saw that they were really focused on the commercial indices associated with success between the different AI methods, including whelping rates and litter sizes. And none of the studies really looked at the welfare implications associated with the different AI methods, despite many studies considering the ethical implications of surgical insemination because of the increased risk associated with anesthesia and surgery. Only one study really listed or described the complications observed in the methods, and one study focused solely on an ethical matrix in decisions about performing AI on dogs overall. So to the aims of our study, our first hypothesis was that the commercial success rates, according to the literature, between the two methods of insemination should be similar, and that would really support the use of the less ethically challenging and more welfare-friendly transcervical insemination. And to do this, we evaluated the Greyhounds Australasia breeding data of frozen semen inseminations between 2012 and 2020 to compare the different success rates between the methods of intrauterine insemination. And the second part of our study was we surveyed the Greyhounds Australasia registered veterinary technicians regarding the factors which influenced their choice of AI technique, and also the associated welfare outcomes that they experienced with these two methods. And we really aimed here to identify the barriers and drivers for change towards an AI practice which focuses on animal welfare. And then lastly, we conducted an ethical analysis of decision-making in the choice. So if we have a look at the methodology that we used, you can see that it's twofold. Firstly, we've got the breeding data analysis of all of the breeding data contained within the Greyhounds Australasia database. And here we looked at 15,957 services of 9,444 individual greyhound females. And then we performed some modeling in our statistics. And we asked two distinct questions of our data set. The first, is there a statistically significant difference in the outcome variable pup count? So that was the number of pups overall produced between the different methods. And for that, we ran a generalized mixed model with Poisson distribution. And then we asked whether there was a statistically significant difference in the failure rate or the chance of 0 pups being produced between the methods. And to do this, we had a linear mixed model with binomial distribution. We then also conducted a survey of registered veterinary AI technicians, and the survey obviously had Human Ethics and Research Council approval from the University of Edinburgh. Our questions were really routed according to the method that the vets most frequently used, so they could choose either transcervical or surgical insemination or both, and those who selected both then were routed to complete both sides of the survey, and those with a singular predominance only completed one side of the survey. And we asked them questions about the types of insemination which they performed, the factors, drivers and barriers influencing their choice to perform a certain AI technique, and the type of examinations they performed pre and post procedure, the types of risk mitigations and controls that they employed in their practice, as well as the complications that they observed with the different methods that they used. So looking at the data that we received out of the Greyhounds Australasia database, this table is the complete pup count data set for each service producing at least one puppy during the study period. And here you can see the real predominance towards surgical insemination. So out of the 12,451 services that produced puppies, 97.6% of them were surgical inseminations, and only 1.9% of them were transcervical inseminations. We also found this other classification called intravaginal, which we decided to include in the data set, and we hypothesized that these were failed transcervical inseminations that they decided to instill intravaginally. So you can have a look at it. By far the highest proportion of puppies at 97.9% were registered as a result of surgical inseminations. And when we looked at the mean pup count, you can see that the mean pups per litter was 6.44 for surgical insemination and 5.81 for transcervical, and then dropping away to 5.61 for intravaginal insemination. So it was really consistent with the literature here. And when we looked at these simple statistics, we saw that there was a huge discrepancy in the sizes of the two data sets, and it was not going to be able to really reliably draw any conclusions from just looking at this data because of the skew towards and the predominance of the use of surgical inseminations. We also saw there was quite a high percentage of services that didn't produce any puppies. So quite high, 22% of services resulted in 0 puppies, and the litter size ranges were also huge. 1 to 16 puppies for surgical insemination and 1 to 13 puppies for transcervical insemination, and this also really fitted within the literature that described greyhounds as being highly fertile fecund breed. So here in this table is the results of our generalized mixed model, and I'll just quickly show you the variables that we included in our model. So we had a look at the dam as a random effect because multiple dams were used multiple times inside the data set, and we included dam age as a quadratic, and then parity of the dam as a categorical variable to account for females that may have had 1 to 3 litters compared to females who had more than 3 litters. And we made this distinction based on a current rule which limits the number of litters to 3 in greyhound breeding females without a special exemption to have additional litters. So looking at the results of our generalized mixed model, after the differences associated with dam age were accounted for, there was absolutely no significant difference in the pup counts recorded across the different methods of insemination, which means that there was no statistically significant influence of method of AI in the outcome variable. Parity as the categorical variable, which we mentioned previously, was significant in the model, and the pup counts for the dams with more than 3 litters were significantly lower than those with 1 to 3 litters. When we looked at the estimated means, which you can see here, the parity of more than 3 litters accounted for about 5% fewer pups than parity 1 to 3. So this table really summarizes the results of our binomial model, which looked at the probability of having 0 pups associated with the choice of AI method. And after differences associated with the age of the dam were accounted for, the results show that compared to surgical insemination, transcervical insemination and intravaginal reported significantly less successful litters. And the mean probability of success demonstrated here of having at least 1 pup per litter was 70.2% for surgical insemination versus 48.1% for transcervical insemination, and as low as only 20.7% for intravaginal. So only surgical insemination was not statistically significantly affecting the likelihood of 0 puppies. So moving on to some of the results from our survey. So here we're looking at frequencies in responses, and the first graph on the left shows frequencies of the types of insemination methods performed by the different technicians, and you can see that the dark blue line, that surgical insemination is most frequently performed, with TCI being performed by some, and fresh TCI by some. If we look at the chart on the right, this chart looks at the frequency of ranked factors influencing the choice of AI method. So this was really the drivers that veterinarians, or barriers that veterinarians experienced in the choice of AI technique that they used. And you can see the blue lines, which were really important, were the equipment available, being the specialized equipment, the scientific evidence of a success, that was really important to veterinarians, the opportunity for training, the value of the semen, and also market forces beyond their control. So I think really importantly here, training for veterinarians was linked to opportunity cost as well as the availability of training, and a number of vets in their responses considered the number of TCI inseminations they were being asked to perform versus the benefit of upskilling and the time and cost of that training. But really importantly to come out of this was that vets were not the main decision makers in the choice of AI method performed, and that they were being asked to perform certain methods. And this was being driven primarily by stud masters who were incentivizing surgical insemination by offering a free return to service or a free replacement semen straw for a miss whelp for surgical insemination, but a refusal to do so for transcervical insemination. So that was really interesting for us, because the data that I presented previously on the risk of failure was a surprise to us and contrary to our hypothesis on the 2 success rates. So we can see clearly this was knowledge held within the industry that was driving the commercial decision making to really skew towards surgical insemination within the industry. So looking at some of the results of the questions into procedural risk mitigations, you can see here that we asked about things like antibiotic use, post-procedure pain control, prophylactic pain control, whether temperature was controlled, the level of monitoring under sedation or anesthetic, and whether intravenous fluids were used routinely during the procedure, and whether pre-procedural blood profiling was performed. And overall, the surgical insemination cohort reported using more health risk mitigations and controls, which really reflected the higher risk of anesthetic. And most respondents answered no to routine prophylactic antibiotic use. In the surgical insemination cohort, interestingly, prophylactic pain control was always used in 96.3% of respondents. So that was really encouraging. And pain was most often assessed by using behavioural indicators or physiological indicators of pain. And absolutely no one selected yes to greyhounds don't feel pain and therefore don't need pain relief. So these slides are the results of the reported frequency of complications between the two methods of insemination. And you can see here that most frequently transcervical insemination on the left, the blue bar, has no complications. No complications were actually very frequently seen with surgical insemination on the right as well. But overall, if you look at the medley of colours, pain was quite frequently observed with surgical insemination, as well as post-procedural infection or adhesions, pyometra, chronic pain, even excessive hemorrhage, seroma formation. So overall, there were more complications, including death, excessive hemorrhage, and chronic pain reported with surgical insemination than observed in the transcervical insemination cohort. So the conclusions of our research was really that surgical insemination was more likely to produce successful litters than the other two methods studied, and our initial hypothesis was actually not proven. When we adjusted for the age of the breeding female, the method of insemination did not significantly affect the number of puppies registered, and this is consistent with one of the studies we looked at and at odds with another. The parity of the female was an important effect in our model and accounted for 5% fewer puppies in females having more litters. Again, this is consistent with one of the studies in the literature and at odds with another. In terms of the survey, the welfare implications of surgical insemination as a routine procedure are certainly more significant than with those of transcervical insemination, and this is consistent across the literature. Equipment, training provided, and the market forces we discussed were identified as important factors influencing the choice of veterinarians to perform surgical insemination rather than transcervical insemination. Surgical insemination, we know, is currently being performed with a high degree of awareness of pain and other complications and risks, and these are well mitigated across the veterinary group we surveyed. Changing attitudes will really depend on an analysis of the welfare costs versus the commercial benefits to the industry, and needs to really include a wide group of stakeholders. It needs to consider improved access to veterinarians for training in TCI to complete the shift in method. So looking at the welfare implications of our study, one of the risks was that our findings might be used by the industry to justify the continued use of surgical insemination, given that it is commercially more successful, according to our research. But I don't think so. I think our study really highlights the ethical and welfare arguments, which should be weighed by a broad range of stakeholders in the decision to continue with surgical insemination. It was encouraging to see that the surgical insemination technicians really reported a high awareness of the welfare risks and employed frequent and appropriate controls and mitigations to those risks. Our survey determined the frequency of complications observed in both surgical insemination and transcervical insemination, and established that transcervical insemination was less often associated with pain or other health complications which negatively affect welfare outcomes. Our survey importantly really highlights the barriers to veterinarians performing transcervical insemination more successfully, and provides evidence on which to base future professional development to facilitate a change in the industry towards a more welfare-friendly AI technique for greyhound breeding females. Lastly, I'd really like to acknowledge my supervisors, Professor Peter Sander and Madeline Campbell, for their input on this research, as well as Greyhounds Australasia for their breeding data and survey support. Thank you.
Another great talk there. So next up, we've got a talk on hair cortisol and what is it really telling us, examining the relationship with other physiological and behavioural measures in companion dogs. And this will be presented by Carmen Glanville at the University of Melbourne.
Good afternoon, everyone. My name is Carmen Glanville, and I'm a PhD candidate at the University of Melbourne's Animal Welfare Science Centre. And today I'm going to be talking to you about hair cortisol in relation to dogs and dog welfare, and what's it really telling us. But before I get started, I'd just like to acknowledge that the work that I'll be presenting today was conducted on the lands of the Kulin Nation, including Wurundjeri, Bunurong, Wadawurrung and Djaja-Wurrung country. I'm also recording this talk from Wurundjeri country as well. So I'd like to pay my respects to the traditional custodians of these lands and their elders past, present and emerging. Now, I'm sure this is probably common knowledge for most of our audience here today, but I just thought it best to quickly take it back to basics a little bit, just to ensure we're all on the same page. So there are two primary physiological stress responses: the sympatho-adrenal medullary system, which is the immediate autonomic nervous system response, and then there's the hypothalamic pituitary adrenal axis, and this is the neuroendocrine response, which takes a little longer and is more enduring than the SAM. So cortisol is a glucocorticoid produced during the activation of the HPA axis. So cortisol concentrations are then taken to reflect the level of activation of that HPA axis, and it has become incredibly popular as an indicator used in animal welfare assessment. So cortisol can be found in a range of different matrices, including blood, saliva, feces, urine, and even fingernails. And these different matrices kind of provide different temporal profiles of HPA activation over different time periods. So hair, as a matrice of cortisol, is a much longer term profile than some of these other matrices, such as saliva or blood, because cortisol is laid down in the hair as it grows. So this is very promising from a welfare assessment perspective, because while acute stress responses are important for sure, we are often more concerned with chronic stress, particularly in a species like companion dogs. But because hair has not been used as extensively as some of these other matrices, there are still plenty of questions that remain, including potential confounds and their relationship with other animal-based measures. So the current study that I'll be talking about today was actually part of a much larger study in which we're looking at the relationship between owner perceptions of dog welfare and animal-based indicators of dog welfare to see if they kind of match up. So one of the animal-based indicators we used was hair cortisol. So that gave us the opportunity to look at some of these confounds and relationships with other measures. So today I'll be talking firstly about some potential confounds, including dog age, size, and hair colour, because this is particularly important when it comes to dog welfare assessment, because dogs are such a highly variable species that it's really important to limit or at least account for potential confounds when comparing between dogs. Secondly, as part of the larger study, as I said, we used a range of different welfare indicators. So this then gave us the opportunity to look at the relationships between them. So we'll have a look at heart rate variability, pulse, respiration rate, and activity levels, which were all measured using the Pet Pace Smart Collar, which we'll talk about in a sec. And also some behaviour and behavioural problems, which were assessed using the CBARC. Again, we'll talk about that in detail. So firstly, the Pet Pace Collar, modelled here by one of my furry participants, is essentially like a Fitbit for dogs. It gives you activity, postures, pulse, respiration, and perhaps most interestingly for me, heart rate variability. You have the option of sampling every 2 minutes, 15 minutes, or 20 minutes, and we use the 2-minute option, and the dog's walker collars 24/7. So this really enables you to get a much broader picture of the animal's experience, and also allows you to get 24-hour heart rate variability metrics like SDNN, which are considered the gold standard of heart rate variability because it combats some of the variations you may see due to diurnal patterns. And I could actually monitor all these metrics in real time, which is really helpful from a practical perspective when doing research. So then we used the Canine Behavioural Assessment and Research Questionnaire, or the CBARC, to look at dog behaviour in a little bit more detail, particularly behavioural problems, which can manifest due to poor welfare. So the CBARC is a validated tool used for owner-reported dog behavioural problems, and it was developed by Sue and Serpel back in 2003. And it looks at 7 different categories of behaviour. Now, the premise of the CBARC is that dogs show signs of behavioural problems in a range of different settings, and that owners have the best understanding or awareness of their dogs across these different settings. But I think it is important to recognise that while the questions are worded in a way so as to reduce sort of a subjective interpretation, these data still rely on owners being observant enough or understanding what they're seeing in their dogs. But at present, it's kind of still the best that we have, considering it's very difficult to do direct observations in the home environment. As for the hair sampling itself, this study was actually conducted while we were still under some COVID-related public health orders here in Melbourne. So we weren't actually able to visit people in their homes and shave the dog's hair ourselves. So what we did was we provided owners with these little pocket clippers and gave them very clear instructions, including photos, to shave a 5 by 5 centimetre patch from the ischiatic region. Now, the reason I actually mention this is just that when I was looking for published protocols, the size of the patch really varied up to even 10 by 10 centimetres, which I think is quite large, and I was a little reluctant to ask my owners to shave this much hair from their dogs. But it turned out that 5 by 5 turned out to be more than enough for the vast majority of dogs. So that's just a nice little practical takeaway. We also got owners to take photos of the shaved patch of hair just to make sure that they'd done it correctly and in the right place. So I got all these little pictures of dog bottoms, and then the hair was stored in Ziploc bags in the dark until we analysed it. So the data collection period went for 2 weeks. So we had the hair shave at the start, followed by 2 weeks of the remote monitoring with the Pet Pace collars, and then the owners completed the CBARC at the end. So we couldn't do all participants at the same time because we didn't have enough equipment. So we ran it in cohorts of about 10 dogs at a time. And this ran from October last year through to February this year. And while we had 50 dogs actually participate overall, only 48 yielded enough powdered hair for cortisol extraction. These were from really short hair dogs. So in those instances, it would be advantageous to take a slightly larger patch. And as for the dogs themselves, as you can see, we had a wide range of sizes and breeds. They ranged in age from 1 through to 14, with the average being 5.5. So a lot of variability in there, as we see in your standard dog populations. So what did we find? First of all, I'll start off with our potential confounds. So we found no statistically significant difference between dogs with different colour hair. So there have been previous studies that have seen a difference and others that haven't. So here we're just adding to the no difference side of the tally board, so to speak. But it is important to note, as I've got down there in the bottom, that because this wasn't the primary research question, we did have an unbalanced groups, which does reduce the power of the ANOVA. So this is just something to keep in mind when interpreting these results. Moving on to age then, which has been suggested to be a potentially confounding factor, particularly relevant to dog welfare assessment because we're often not assessing dogs that are all the same age. Again, we found no significant relationship between age and cortisol concentration. So this is a promising sign, though of course, to truly ascertain whether there is an age effect, we'd have to do repeated measures of the same dogs over their lifespan, which would be great, but time consuming. So also with dogs being so variable, their size is often known to affect various physiological parameters like heart rate and such, but again, we found no statistically significant difference between dog sizes in our study. And finally, I just thought I'd include this one as a little extra because we didn't look at seasonality specifically, but because our study was conducted over a 6-month period with different cohorts, there was definitely variation within the weather, starting from mid-spring through to late summer. And if you've ever been to Melbourne or live in Melbourne, you know the weather does change a lot over that time. But again, we found no statistically significant difference between our cohorts. So through from spring, mid-spring cohort 1 through to late summer in cohort 5, no difference. So then moving on to the relationships with other animal-based measures, as you can see here, we again found no statistically significant relationships with any of the physiological measures, so including pulse, respiration, and a whole range of different heart rate variability metrics. The only pet pace measure that there was a statistically significant relationship was activity. And this relationship makes sense because activity itself is a physical stressor and is related to increases in cortisol concentration. And so this does really highlight to me that we have to be careful when interpreting cortisol, that not all stresses are negative and it could just be reflective of higher activity levels. Finally, we looked at those relationships between the CBAT behavioural categories. Now, these analyses were with linear mixed models to account for the fact that we had multiple owners filling out the same questionnaire for the same dog in many instances. So we included the dog as a random effect to account for this dependency. But as you can see here, we only had one statistically significant relationship, and that was a small negative relationship with aggression. So the higher a dog scored on owner-reported aggression, the lower the hair cortisol. So this is somewhat counterintuitive, and I am reluctant to place too much importance on this result because first of all, it is quite small a relationship, 0.17. But also it could be a positive, as a false positive, given that each of these different behavioural categories was a separate linear mixed model. And we also have to remember that this is owner-reported dog behaviour. So perhaps even if an owner is more aware of their dog's aggressive responses in different situations, then perhaps they're more likely to manage them better, and thereby resulting in less stress to the dog compared to owners that don't notice and don't manage it. But this is essentially conjecture. We definitely need more work to look into this more closely and see if this is actually a thing and means anything. So to summarise, we found a moderate positive relationship with activity. We found a negative small relationship with owner-reported aggression. And we didn't find any statistically significant relationships with anything else. So from this study, what is hair cortisol really telling us? Well, perhaps unsurprisingly, and also perhaps I'm preaching to the converted here already, but for me, it really highlights how complicated these animal-based indicators of welfare are and how little we still know about what they're telling us in terms of an animal's welfare state. It also really highlights to me the risk associated with using single animal-based indicators of welfare in assessment protocols and the real need to integrate a range of different measures to get a better understanding. It also highlights that there is a lot more basic research needed to be done in this field, particularly with balanced designs and longitudinal studies. So thank you so much, everyone. I'd just also quickly like to thank UFAW and RSPCA Australia for funding this work. Thank you.
Okay, that was fantastic. We'll just wait for all of the speakers to join us. Thank you so much, everyone. It just kind of reminds me how diverse a area animal welfare is, and forums like this really kind of highlight the diversity that we face with animal welfare, but it always keeps it interesting. So we've got a few questions. We've got about 20 minutes. So for the first question, for Michelle, how does the frequency of various AI methods compare to natural mating as a proportion of all breeding within the greyhound racing industries in Australia and New Zealand?
Hi, thanks for the question. As I said, during the study, the most frequently used is artificial insemination using frozen semen. So natural mating is used, but it's certainly a low proportion of all of the matings, of all of the breedings that we see. So they probably account for less than 5% overall of all of the breeding that we're seeing.
And does that differ, Michelle, between Australia and New Zealand that you're seeing?
I didn't separate them per se. And the industry, particularly the breeding and stud book side, is controlled by Greyhounds Australasia as a single body across both of the countries. So from what I've seen, both sides of the Tasman, the industries, particularly the breeding industries, are very similar. They're using similar sires and both using a high degree of frozen semen inseminations.
Awesome, thank you for that. So we'll just move on to the next question. So this one's for you, Carmen. Does shaving dogs prior to the behavioural and physiological observations assume that the record is indicative of prior behaviour? The assumption based on that they can't help but think that owners may be on their best behaviours during this observation period.
Yeah, absolutely. So as I said, this study was part of a larger study. So the reason that we did the shave at the start was because the really primary research question was comparing those owner perceptions to the welfare measures. And in the questionnaires, we did a sort of general look at their dog's welfare, saying, you know, please rate your dog's welfare in general, and on overall welfare, physical health, mental health, that sort of thing. And so the reason we did it at the start was that we wanted those two things to line up, as opposed to shaving it at the end, as you say, after they've had 2 weeks of being on their best behaviour as well. So that's why we did it at the start. Yes, there is a little bit of a mismatch there between then the behavioural observations of the dog with the pet pace collar and that sort of thing. But because hair is such a long-term profile, I don't really feel like it would have made that much difference, the 2 weeks versus because we're using old hair, we're not doing a shave reshave procedure. So I don't think it would have made too much difference.
Fantastic, thank you. So we've just got another question that's come in for you, Michelle. Is oversupply of greyhounds an issue that is present in the Australian industry, and is there an opportunity for the industry to view an increased use of TCI as one way of readdressing the oversupply, given the relative likelihood of successful it is between the two methods?
Yeah, that's a good question. Thank you for that. I would say that all industries need to look for ways to improve welfare. I mean, we need to engage with the concerns of the community and the concerns more broadly around animal use in different industries, and look for ways to improve their welfare. In terms of the oversupply, I'd say every single industry that I've worked in or encountered, whether it's New Zealand or Australia, is acutely aware of that as a massive welfare issue, and certainly tracks the production of puppies on an annual basis versus, for example, the rehoming rates or the exit rates from the industry. And another important welfare sort of milestone that they look at is the utilization rates. In other words, for the puppies that are being bred, how many make it to the racetrack versus how many are retired before they make it to the racetrack and rehomed, and very much a focus obviously on euthanasia rates and reducing unnecessary euthanasia. So I can see where you get to, if TCI produces fewer puppies, then potentially that's another benefit of TCI. However, that's not the focus of the industry, is it? And that's probably why the breeding literature focuses on success rates, which include, you know, how many pups per insemination can we produce? That's the entire purpose of breeding specialists, and the focus of a breeding industry is to produce as many healthy, viable puppies as we can. So I think that will always be the mainstay and the focus for people who are breeding specialists and involved particularly in artificial insemination. I think for me, the focus has to be is where you have a certain failure rate of a method, or even success rate. You want to be sure that the method that you're using is the most welfare friendly and ethically sustainable method that you can use for the industry, and move towards a shift that really prioritizes animal welfare as an outcome measure.
No, fantastic, thank you. And we've got another question for you, Carmen. Do you think that you might have had a more significant result if you were using animals that were actually suffering from poor welfare rather than well looked after dogs and pets?
Potentially, we could have seen differences in some things, but that just raises a significant issue that we have in dog welfare research, is the difficulty we have with recruiting participants that do have poor welfare. So we kind of took this approach with this work, that given the large number of behavioural problems out there in the community, that a general sort of recruitment process would capture some dogs with anxiety and behavioural problems and that sort of thing that would be indicative of welfare problems. Yes, they're not going to be the most extreme welfare problems, and perhaps, you know, for things to influence cortisol and in the hair, maybe it does have to be really extreme. But I guess we need to take into account in interpreting these results that it's kind of this general population that we're looking at.
No, fantastic, thank you. And just a question for all of you, and I should have said from the beginning, we've got Margarita joining us, and I hope I've pronounced your name correctly. She's representing Marisa, who gave the talk, our first talk. It would be really interesting to know just from each of you, where do you kind of see the future being for the techniques that you talked on today, or kind of what's the next step in the research? So Margarita, if you wanted to kind of start us off.
Thank you all. Can you hear me okay? Thank you. Well, I'm obviously not Marisa. Unfortunately, she's not very well tonight, so I'm stepping up for her. She's my PhD student, and every time that we test another animal model, our first concern is to try to refine that animal model. And in this case, we had a lot of previous information how we should do this animal model, but instead of doing what everyone else was doing, we tried to reduce fasting and start using analgesia. That's something that it was not common in this type of animal models. So we try to do this every time we encounter a new animal model, and this type 1 diabetes is one of the oldest that we've tried, and I was very happy to see that we could do it even in such an old animal model. We're now proceeding to do these studies with something else that animal models. We're trying to study this in real diseased animals, dogs and cats, and so we're trying really hard to try to use animals at a minimum, laboratory animals at a minimum. That's our goal. I'm not very well also. I'm having some difficulties. I'm best than Marisa, so
fantastic. Thank you for that. Yeah, absolutely. And Michelle?
Yeah, so the aim really of our research was to stimulate a conversation within the industry about a shift towards transcervical insemination. And to that end, we have put together a working group within Greyhounds Australasia that's really looked at this issue and prepared advice and papers to the Greyhounds Australasia board in how we can support the education of veterinarians in transcervical insemination firstly, so that we can really prepare the industry adequately to have the best success that it could have with a shift to TCI, and then look to solutions and how we might transition them through that. So it's exciting to be part of the progress on that front.
Oh, awesome, thank you for that. And Carmen, we'll finish with you. Lucky last.
Yeah. Thank you. Well, as I kind of said there in my presentation, I'd love to see and continue to work on more basic research. So a lot of what we do in dog welfare is applied research, because there's so many real world problems out there that we want to get into, and that's what this study was overarchingly, was an applied study. But in that, you start to realize, well, actually there's these nuts and bolts of the basic research, of the basic physiology, and what is it really telling us about the animal's subjective experience. We have all these indicators, but how do we integrate them, and how do we really make sure that we're understanding these correctly before we can actually even apply them in welfare assessment. So I'd really love to see some very controlled, robust basic research on those sorts of things.
Oh, fantastic. A huge thank you to all of our speakers and panelists for joining us today. And I'll now just hand over to Kat and Mia to close the session for us.
Thank you, Sarah, and to the wonderful speakers. What an amazing day one of this event. And I think apart from Hugh's power outage in the opening intro, we managed to pull it off without too many technical hassles. Kat, is there anything else you'd like to say to everyone who's joined us today?
No, I'd just like to say thank you very much for all the great questions we've had coming through. They've shown a lot of thought and just, yeah, been really great to pass on to our speakers. We've had some really great discussions. Thank you very much for joining us.
We look forward to seeing you all again tomorrow and on Thursday as well. Thanks, everyone.
All right.